We welcome Dr. Anita Jain, a Vancouver dentist. She is experienced in breastfeeding and in the issues of tongue tie, as she worked throughout her student days at the breastfeeding clinic. In this section, you will find out about the damaging oral and dental effects of tongue tie, which can affect both children and adults. Also, the dental problems from the inability to breastfeed. Poor dental hygiene can also be a consequence of tongue tie. Some of these cause serious issues, not to speak of great expense. 5-figure invoices are not uncommon.
So most people who aren't involved in the dental field don't realize, because they haven't thought of it before, the profound impact that the musculature of the oral cavity will have on the whole development of the mouth, including the dental arches, the palate, and oral hygiene. So I just wanted to talk to you about that for a few minutes. One thing to do with the tongue tie that is very important that many people, again, wouldn't consider is that if you have a tongue that's tethered to the floor of your mouth and you don't have the freedom of movement that most of us do have, you lose a major method that we all use unconsciously to clean our teeth after a meal, and that's simply extending our tongues all the way around. We can clean almost all surfaces of our teeth simply with our tongue, which is actually quite a textured surface, and it spreads the saliva around. It does some mechanical cleaning of all of the surfaces of our teeth, and if you have either a very small short tongue or a tongue that's tethered with a tongue tie, it simply can't do that, and so you end up having more food caught in your teeth, more food and plaque stuck to the surfaces of your teeth. And that can obviously impact your decay rates, your gum disease, all of that sort of thing. So that's very important. Another very interesting phenomenon is the effect that the tongue and the cheeks, just those muscles have on the development of the dental arches and the palate. So the bones, as they're forming, are actually quite malleable, and the musculature of the tongue, how we move it, how it pushes against the inside of our teeth, as well as the pressure from our muscles on the outside, from the cheeks, affects actually the form of your arches. So we all have kind of a genetic blueprint to what arches we're going to have, but if we add in different, say, outside forces, such as the nipple of a bottle, it doesn't flatten like a natural breast nipple does. And so whereas a human nipple will flatten within the mouth and spread out, and the tongue will press up against that and form a nice wide flattened palate, the nipple of a bottle is stiffer, and that impact creates a different type of suction within the baby's mouth, creates a more vaulted palate and a narrower arch. And extended use of say a pacifier or a thumb sucking or a bottle will cause an exaggeration of that, such that the palate can become very high and arched, very narrow, especially the upper arch, which can end up being narrower, say, than the lower arch, as well as, if it's extended over a long period of time, the front teeth will actually not be able to close. So if you have a child who's always sucking on a pacifier, always sucking on their thumb, they have that pressure inside their mouth that's foreign body, pressing where it shouldn't be, and then they have the exaggerated suction, and that will actually push in, the thumb or the pacifier will push up, and the teeth will basically grow around that. And so there are many, many adults who as adults, have teeth that in the front won't come together. So their back teeth will come together, but they're unable to incise food. They can't bite into a sandwich or bite through pasta, and it's a very difficult problem to resolve, because it's not just where the teeth are, but it's where the bones are that support the teeth, and it's orthodontically very difficult. So that sort of thing is best prevented with breastfeeding, with stopping those habits that many children have as early as possible.
So here we have models of two arches that demonstrate what it is I was talking about arch form. This one, you can see, quite a bit narrower than the other one. This person probably in childhood had some sort of habit, likely bottle fed, and possibly thumb sucking. And you can see, looking at these arches, the difference, just looking straight on. There are a few problems with the narrow arch. One is a more superficial issue, which is a somewhat less aesthetic smile, because it's not as broad, not as many teeth are showing, so it means not as big a smile compared to this one. The other thing is, if you look at the arches this way, this one is very narrow through here. The arch isn't really in line the way it should be, kind of snakes around because it's trying to fit into a shorter line, basically the same number of teeth, so you have some crowding here. Whereas this is an arch that's never had any orthodontic treatment. Perfect arch, everything fits in perfectly. And if you think the way an arch in a mouth works is the same as the way a Norman archway works in sustaining itself and supporting itself. So the teeth are always shifting over time. Teeth are always wanting to, as strange as it sounds, shift forward. So when you have an arch like this, where things aren't ideally lined up, you're going to have increased crowding over time, increased collapse of the arch. Whereas this one will actually sustain itself throughout the life of this person, and it will stay virtually unchanged. So, very interesting.
This presentation highlights one aspect of the responsibility we carry when we care for babies at a critical stage of development, when we may be able to prevent serious consequences. Dr. Brian Palmer, our greatly valued colleague, passed away tragically this year. He has always generously shared his huge fount of knowledge and resources. These slides will show the effects of tongue tie on dentition throughout life. He wants you to remember that tongue tie does not go away. Here is Dr. Palmer's motto. In this slide, the frenulum is attached high on the back of the lower gum, pulling the teeth back. A tongue thrust in this 4-year-old will push the teeth forwards, causing an open bite. The teeth cannot meet properly, and she will likely need orthodontics. Here we see a similar process in an adult. This shows an extremely high palate as a result of tongue tie. This factor in a baby exaggerates the effect of tongue tie as the vertical distance between the tongue and the palate is increased, thus reducing the baby's efficiency at removing milk. Tongue tie has contributed to this very narrow dental arch, which will lead to bite problems. And the limited space within the arch causes the crowding of the teeth, possibly leading to the need to remove some of these teeth. Now we see such a severe tongue thrust that the lower teeth were actually loosened by the pressure of the tongue and had to be extracted. Dr. Brian Palmer would be delighted that his knowledge and work continues to inform us all in order to help mothers and babies breastfeed.